When I drive around the Commonwealth of Pennsylvania into a lot of towns and communities, I observe a variety of different things, but I'd say three things kind of jump out at me at least. One is you always sort of notice the hospitals and the health systems and kind of the medical care providers when you go into a community. You see their signage, you see where they're located. And obviously we have lots of facilities and hospitals and doctors that serve our communities in Pennsylvania. We notice the aging population. We have an older population in Pennsylvania. I think the statistics would sort of show that as well. But I also noticed that we have a lot of very unique towns, York, being a prime example, with some interesting architecture and buildings, some of which is being remodeled and restored, and some of which is still kind of sitting abandoned. So when I think about these three things and the term that you used, aging in place, and I also think about some of the other issues affecting our older population, because I think, Ann, you mentioned it earlier, we have social isolation, falls, food, the healthcare needs of an older population. It seems like if we could figure out how to kind of make these things work together, we could create something unique here in Pennsylvania. And I guess that's just broad thinking. There's all these different resources that we have. It's just a matter of really connecting the dots. And is there any place that really has done this well? Is there a model of this nationally that, or should we become that model?
I think different communities have done different things. We have in some states where they've created housing very specific to a low-income population, very similar to what we're seeing in our personal care homes. Mm-hmm. And they've done a really good job in Illinois in reducing cost and maintaining that population, extending their time in the community before nursing facilities need it. I think we've seen some small communities pop up where you have small community homes that are clustered. Mm-hmm. And so you have a real home-like setting, being able to sort of support a real community integration model. And I think that's ideal. But I think each community is unique and has to look to the resources they have. Are there buildings? And we're looking right now, we're actually looking at 2 different buildings and saying, could these be retrofitted to support the needs that we identify? And if not, then you look to see whether or not we can identify enough resources to do new construction.
So it's you saw me smiling a few minutes ago because this topic around community infrastructure and buildings in particular and aging in place was one of our discussion points at an advisory committee we have in the community called Embracing Aging, the advisory board. And we were talking about a building downtown that Wellspan is involved with that has a step to get into the building. And the step, people were questioning, why would Wellspan put a step to get in when people with disabilities and walkers and canes, a step is more difficult than a ramp. And it came down to the Historical Society required it. And so it really speaks to it takes everyone. So we need the Historical Society and those with those oversights to recognize what's needed from infrastructure to be able to have aging in place. While you want to recognize cobblestone walkways are important, at the same time, if you have a philosophy around aging in place, you have to be able to put that into some perspective or look at adaptations of that that are allowable, if you will, to be able to create that environment in the community. And so it's just an example of it's more than what you think it is, because who would have thought that would be a part of this discussion, but in fact it really is.
Yeah.
And integrating communities, we talk about livable communities, and I think the ideal community is a community where the individuals have choice in where they live, and that choice allows them to connect to the services they need, whether it's transportation or walkable space or access to green space. I think, ideally, we build these livable communities that really promote people being able to remain as independent as possible in the space they choose to call home.
So, this broad area, housing, food, economic security, energy assistance, people call social determinants of health. And there have been some influential studies that show that while the vast majority of dollars go to our medical system and enterprise, drugs, devices, doctors, so forth and so on. A lot of what determines health are these other things. And I think there tends to be some skepticism too that, oh yes, the healthcare system is going to, help to resolve these issues, when a lot of the dollars are coming in, to kind of the healthcare enterprise. And I think you all faced some of this when you first embarked on working with the community, maybe a little bit of skepticism about, sort of your intentions and ability to kind of partner. Any lessons you've learned from that for other health systems around, being involved and getting involved in this, and, showing and demonstrating in good faith, the willingness to partner with communities?
Yeah, so I would say a couple things. We took a very pragmatic approach initially, and some of it was when asked the questions from the community, I don't know that we necessarily had an answer in terms of, well, why, what does this mean? And even internally, when we were seeking approval to move forward with our work, there was a desire to have everything kind of figured out. And there was a little bit of a need to be able to trust that we're going to figure it out as we go. It's interesting. I don't know that healthcare in and of itself drives the higher utilization. Healthcare has to be prepared for a lower utilization and dollars to be refocused elsewhere in the community. And I think that's a hard concept in many communities, because they see healthcare as having a lot of dollars to it. But I don't know that it's necessarily in healthcare's control in terms of the driver. I don't know that we're the driver in it, but we definitely need to be prepared for a better alignment to support more social infrastructure. So we need to recognize that with the state needing to increase a low-income personal care home from $36 to $75, that may mean lower rates in terms of healthcare payment rates and other changes to support that. And understand how those are connected. I don't know, what would you say?
No, I would agree. And I think, we were careful as we started the Alpha project that when we moved forward, we did not want Wellspan to have the ownership of this. We wanted to be a supporting partner, but we really believe that if the community is going to make progress, they need to own the issue and own the outcomes. And I think we've been really pretty successful in that. So for other communities, it's easy to see the health system as the sort of the elephant in the room, and the enterprise that has the resources and can move forward. But it's really the engagement of the community where you see progress.
Yeah. And we have a role to play. So like with Arches, the clinical support to that program, we have the medical oversight, we have a prescription program that's participating, our home health care. Those are all services we bring to support that program. And it's important. That's our role with it. But really, addressing the need for long-term sustainability of that low-income personal care home is not something that can be dependent upon healthcare in and of itself.
We think about the aging population in Pennsylvania. It's always interesting to think about the capacity to make decisions and the involvement of family, guardians, and so forth and so on. Is there anything we should be concerned about there in terms of trying to assist the aging population and aging in place when it comes to the ability to make the best decisions?
Yeah, so I would say that families need to really be able to recognize the need for conversations and decision making to support their parent or their loved one as they age. We talk a lot about this, about end-of-life decision-making, but there's often more to the story than just that end-of-life time. One of the recognitions that I think many people fall short of until they're in the beginning of a crisis with a family member is really looking at the financial stability of someone's resources and what their options are. And so oftentimes it's they have a golden 5 years, and in particular in the last several years with housing market crashes and things like that, people have had a change to their investments. And so it's really hasn't, as a society and as communities, we haven't given our families the tools to really understand how to be proactive on that. And so what ends up happening is we end up seeking guardianship, a court-ordered decision-making, which is really challenging to the state. It's challenging to the family because it's often, not thought of, and so it's chaotic and it's anxiety-provoking, and so it really is an area where, if I had a fifth wish in terms of how do we address that as a society, that we'd have some action items around that topic.